Hello and welcome back from commercial break. We've been speaking with Dr.Fasika and Tinsay. During the commercial, we had I wish the camera was on. But we covered a range of topics. We talked about the brain drain. We talked about basics because I'm just still incredibly shocked by the health fact that you provided with the high rates of blindness. And we had been discussing the major attributions of that, and if we can pick up with that would be great, because I think it would help viewers as well back home.
Right, and I was saying, like, just to even take trachoma as an example. So trachoma is a disease caused by chlamydia trachomatis, infectious disease that spread through person to person, and also flies can spread the disease. So that's why I became interested in the topic, because there's so many simple ways to prevent it. Like WHO implemented a safe strategy consisting of basic things. So like facial cleanliness, washing your face. A lot of times little kids, a mother will have multiple little kids and it's spread from each other. And after years and years, this condition can lead to blindness. But antibiotics, simple topical antibiotics can prevent infection. Surgery to prevent the interning of the eyelashes that causes blindness. So environment, so building a latrine so that the sanitation is contained so that the flies don't spread this condition. So they have this 4 simple ways to prevent this devastating disease which blinds so many people, and it's been eradicated. I mean, you don't see trachoma in the US. When I say trachoma, people think I'm saying glaucoma, because it just doesn't exist here. This is it's a disease that could totally be eradicated.
Right.
So.
And it is the leading infectious cause of blindness in other parts of the world. And like you said, I never saw a case until I went to Ethiopia and saw it. So, I mean, like you said, we don't see it in this country because it's been eradicated, but safe, simple strategies for eradication. So we've actually both done research in that area.
So you said that the World Health Organization had developed
the safe strategy,
right?
Yeah.
But that it hasn't been working, or
It's actually been working. I think it's been successful, but I think it's still a lot of
Exactly.
in a lot of rural places it's being implemented still. So.
Right.
And I know that's one of our mentors at Hopkins, Dr. Sheila West. She does enormous
Tons of work
in Ethiopia, Tanzania, relating to that. So, but I think it hasn't reached all the places. So unfortunately, it still exists in a lot of rural areas in Ethiopia, other places in Africa, so, and the world. So.
And I guess that's essentially, you can attribute that to manpower. I mean, having people to go into the rural areas to teach simple things about sanitation and about health. The reason why I bring that up is because, during the commercial break, we were talking about this brain drain and how the fact that there are more doctors in Seattle than there are in Ethiopia. What's going on? The reason why I ask you about hope is because I'm aware of this brain drain. I'm sure much of the talent in Ethiopia want to come to the West because they'll be properly compensated and the conditions will be easier. But if you can speak a little bit more about
Absolutely. That. I mean, here as a physician, after all those years of school, finally they did compensate you, right? But in Ethiopia, it's really amazing. They told me what an ophthalmologist would make in working for in the government hospital, like how it's just not even comparable. So the doctors are forced to go into private clinics where but
so
these
they're working
are
multiple jobs.
They're so talented, and they there needs to be ways to keep them in Ethiopia, to keep them working for not only those who can pay, but for government hospitals. So I think
you can't even blame, because when you hear about the mass exodus of physicians, I mean, you can't even blame them, because we're talking about, it's just such a dramatic difference in their earning potential and just how much more they're compensated after all their work. So it's unfortunately there's such a huge discrepancy, and
which is why I kept asking about hope and about the possibility of improvement, because it's just, I mean, not only the stark numbers and the amount of people who need help, but the amount of people who are needed to help as well, and the incentive there, because I think a lot of people, once they come here, they get comfortable.
Absolutely.
And so to go back and to face the low pay and the amount of the quality of facility, the amount of equipment, I mean, do you think it'll just take it would have to be a humanitarian type of situation where people go solely for helping people back home?
And I think it's almost like, because I mean, I see it in some acts, this reversal of the brain drain where people in the diaspora are going back, and not just for, just limited service, just, 2 weeks of service, but actually like moving, making long-term, sustainable changes that can help. So I think I see the solution. I don't blame the brain drain. I think unless there's something that changes in the way that people are compensated, or that people are gonna, when they get the chance, they will come. And that, I mean, that's what happened to my family. When my dad got the opportunity to come, they came because they see. I don't think you can. I mean, when you see a better opportunities, better life, then people will come. But I think it's that reversal that can help make an impact in some ways, because I feel like there's a lot of things that people in the diaspora can do, making sustainable changes, not just like 1 week of doing surgery, but actually making changes. Then I think that'll be one of the long-term solutions.
Tinsay, you said in an interview for the jackets. No, don't worry. But for the Jack Kent Cook Scholarship, you wanted to, quote, practice in a hospital or clinic that serves impoverished minority communities while helping families obtain the social support and education to end the vicious cycle of poverty. Do you still have the same aspiration?
I do, and that's, I mean, if you look at Johns Hopkins Hospital, it's in East Baltimore. If you look at the surrounding community, that is the definition of impoverished minority community. And when you're in the U.S., it's hard to accept that people, because you see that there are the opportunities. You see a lot of people from abroad coming and flourishing in this country. It's just really hard to see, people suffering unnecessarily because of things like poverty, lack of education. When you see the schools in Baltimore, how they're just so unequal to schools in richer areas, you just see how it generates this culture of poverty. And it's just, I mean, I still want to do that, and I think that's what public health can offer. So like in the Hopkins surrounding community, you'll see, I mean, the obesity rate's high, rates of hepatitis C, HIV are high. When you come to the HIV clinic, you'll see that 99% of the patients are from the surrounding East Baltimore African American community. So I still want to work on projects that really get to the root of preventing that, rather than just treating the complications. So
and do you feel the same way?
Absolutely, yes. I was in terms of ophthalmology. I mean, one reason that I went to Hopkins and I love it so much is because of the East Baltimore community and the ability to work. So we luckily, because we're at this academic institution, we never turn away a patient because of a lack of ability to pay. So if they have trauma, we can always do surgery on them. And for cataract surgeries, we have these special grants where we can offer and some of them are truly blind from cataract, and then you can actually, it's accessible grants. We as residents, we get like 5 a year. So those are my favorite patients, And I always, when I'm in the U.S., would like to work in this kind of community, And even now when I'm going to Miami, they have a large immigrant population, Hispanics, Haitians, and I'm very excited to work with that kind of community. It's just more, for me, inherently rewarding, and I feel like you provide a good service,
Right. Well, I'm glad that you mentioned that disparity, because like I mentioned earlier, Johns Hopkins is the leading medical school in America, and I think a lot of people back home have misconceptions about life here in the States, and the fact that there's this amazing institution, and you can go one street over and it's a ghetto, or you have projects, and then you could even go one street over the other way, and then you have $1 million homes. And so and the thing is that it's mildly similar, or actually very similar back home, where you see these homes that look like someone just took homes from here, planted them, and then you see poor people sitting outside who don't have a home, or there may be a row of shacks. Could you speak to that disparity that is actually also here, and what maybe those misconceptions are as well?
Yeah, it is interesting to see when, I have relatives come from Ethiopia and they come to Baltimore and they're like, what is this? Because you see like these broken, row houses that are just worn down and things like that. I think disparities in general, that also, I'm optimistic about this too, but I feel like it's a matter of time before the world is much more equal and fair. I think disparities exist in places like the US because for multiple reasons. One I feel like is disparity in the very roots, things like education, basic things.
Right.
So I feel like, until people are committed to providing, when we say like equal education healthcare at way beyond the level before it gets to that. Before we're talking about the complications of HIV
Right.
and the millions of dollars people spend on dealing with those complications. I'm talking like many levels. Until we address those issues, they will always exist. So I think it takes a commitment on part of the community and everyone to change that. So I think it will exist in places all over the world where that you have this the very rich and the very poor. But I feel like the efforts have to be made at the basic level to get rid of that. And I think people are recognizing it and realizing that it should not exist in the world. There is no reason why this extreme difference between poverty and wealth should exist. And
Right.
I feel like a lot of people in public health are working to address that, and that it cannot exist. There's no reason, and I think it's a moral obligation to get rid of it. So
I think another question that could either make things specific or general. I think there's this culture we have of not really taking care of ourselves. A lot of Ethiopian people have existing health conditions and don't take the medication or don't keep up with the doctor's appointments and aren't, and even further than that, aren't being preventative in terms of eating well or exercising, living healthy lifestyles. What could do you attribute that to? Maybe a culture of poverty or ignorance, or just Ethiopians being Ethiopians, not going to the doctor when they need to, being stubborn? I mean, if you could, I think it would be interesting to if you guys can speak to that as doctors, and I'm sure you'll, having treated Ethiopian patients back home and I'm sure here as well.
Yeah, I think part of it does have to do with education, because you do see, the more educated patients are, the more they're aware about these conditions, the more they realize, that high blood pressure, uncontrolled diabetes is going to lead to blinding eye disease, diabetic retinopathy. The more people are going to be careful about their diet and ways to improve it. So I really think it's just about educating, because in Baltimore we see a lot of that. People are just not aware. So they just suffer with years and years of bad controlled diabetes and blood pressure, and then they end up with these devastating complications requiring amputations and laser treatments for their eye disease. So I think it's just about education, and that I think in the Ethiopian community that's also probably the source of that. So I think efforts should be made towards educating people, and once they understand that, I think they'll be invested in these efforts to prevent their deteriorating health. So
I'm glad that you mentioned education, because I wanted to ask about, in addition to this, not taking care of ourselves, there's also this, I don't know if it's pride or what, but a lot of people are embarrassed if they have a condition, and especially back home, people don't want to talk about HIV/AIDS, people don't want to talk about depression, people don't want to talk about maybe mental disabilities. Do you think education programs would help with not only raising awareness, but for people to kind of get rid of these misconceptions or their embarrassment or the taboo nature of a lot of conditions that are highly prevalent back home?
I think that's definitely, and you can see that example with even HIV itself, because when I went back, it was 9 years ago. There was such a taboo around HIV. I never saw any patients, who would come to the clinic and openly talk about it. But now, going back a year ago, with all these, initiatives, and the treatments and the initiatives worldwide to prevent the spread of HIV, that I've really found, patients, just young patients come into clinic, they have their medications, they're taking it daily, and I'm with the physician in the clinic, and they come while I'm there, talk openly about it, and they're really committed to taking care of themselves. They realize it's a condition that they can live with, that's treatable. So I think it's education and destigmatization of these diseases that really changes people's mindset, and you just see people talking more openly about it, and that it's nothing to be ashamed of. It's it's a disease that we need to talk about openly as a solution to the problem, to prevent it and treat it. So.
And I would love if you could speak a little bit more to HIV/AIDS, because I think in us talking about it, we are dispelling misconceptions and breaking that taboo nature. When I went back home, I didn't really see anything. I saw a lot of condom ads, but in terms of education or people openly talking about how they need to be preventative in their acts. Could you talk a little bit more to the culture and how it's changing, or that, you know, ways in which would be better addressed to combat the condition?
Yes, I mean, I know that, for example, Hopkins, through this high, they have actually, like, they have basically, when they come to the clinic, when the patients come to the clinic, I think they have a strong support network for them. So I think that's just by educating patients themselves about how this is a treatable condition. I feel like people are more open to talk about it and providing them medications. I also visited one of the, I think it was called Hewitt orphanages. It was near Sarbates, and it was a beautiful orphanage. I think Sister Mako had started that. I think she was awarded a big prize for this. But it was very interesting because this was an orphanage for children with HIV. I went and visited it, and they took me around to some of the homes of people who had HIV, and they were showing me how they were raising their kids and how this organization provided support for them, and how they would encourage discussion. So, for example, in people's homes, when they had, like, you know, the bunna ceremony, how they would have open discussions about it, and how through just the social network, through like mahabars, they would basically talk openly about these conditions. So I think that's the way, using, you know, things that are accepted in the culture.
Right,
these,
existing social.
Yeah, exactly, because it's such a rich social network that, you know, one of the things that Ethiopians pride themselves on is they're such social beings, and they have this beautiful, you know, social network where they have coffee ceremonies. They spend all this time with people. But I think incorporating discussion of that as part of education about topics like HIV, you know, diseases that are basically, you know, devastating the young people's lives, talking about it openly, ways to address it, and then they have organizational supports first from groups like this one that I visited. I think that's one of the key ways of doing that. So,
you know, I'm always fascinated to ask people this, especially people who were born back home, but mainly people in the diaspora. Do you think you guys still would have followed medicine if maybe your
in
parents,
Ethiopia?
Yeah, if your parents never left, because your father was already, you know, finishing school or finished school. So, do you think that you would have still been doctors if you hadn't?
It's hard. I used to think about that when I was growing up, because you hear that it's very competitive. You know, we grew up here, so we don't know. But I heard about this matrix exam that people took, that you had to get like this high. So it seems like, I mean, and it's sort of chosen for you. You don't really choose it, but
right,
like, I guess
depending on the exam.
Depending on the exam results, they're like, okay, you're going into medicine. But here it was more like,
anybody. I feel like anybody can. Here, if you're, you know, as if you work hard and, you know,
right.
You
So
can try multiple times. You have numerous, you know.
So it's hard to predict if you would have made that cut of being the top. Yeah. So I think we would have kind of had to go with what our exam scores dictated.
Right. Well, what if you? Sorry.
No, but I think you're here, growing up here, then I think that certainly influenced our decision, right, to go into medicine, because, you know, when you know, we went back to Ethiopia for the first time after, because we came here when we were 1, so when we went back for the first time at age 18, you know, when we went back, I saw, you know, how, if I was a physician, how, you know, you could actually, what you could contribute, now specifically for me in ophthalmology. So I think that, for me, for me, public health was always, you know, my love in medicine. So I feel
but here you can justify, you know, you could say, well, I want to study medicine. My score might have not been the actual top highest, but I want to do medicine because this and this. But I feel like in Ethiopia it's more like your exam score. So that might have been.
So, I mean, you spoke to your American identity and how that played into career choice as well. But how much has your Ethiopianness affected your career choice? I mean, there's the obvious of the country being a developing nation, but what of the culture has influenced your life and your profession?
Yeah, I think the work ethic. I think of, you know, being not only from Ethiopia but just immigrants in the US. I think they have a unique work ethic, like none I've seen. You know, like you see. My parents working day in and day out. I think that had a strong impact on my life. And also, like we said, when the contrast, like here, everything if I never went to Ethiopia, I mean, I would just take everything for granted, you know. So it really gives you a perspective on life and things. So I think being Ethiopian really, really shaped you know, my career goals, what I want to do.
Right. And I think growing up in Ethiopia and in America too, you always want to be connected because you grow up disconnected. You don't grow up in that, you know, you have the, you know, diaspora community, but you miss, I feel like, some elements of growing up with the culture back home. So I feel like medicine is another way that you can, because for medicine it's sort of like an international profession where you can go and practice. So for me, I always wanted to look for a profession where I could, you know, do work in Ethiopia as well. So, and I think we've seen that, you know, going back multiple times in various aspects, that's one way to connect you with the people there. I feel like medicine has its universal aspect.
Absolutely. And when I went to India, I mean, I was doing eye surgery there, and you can communicate with the patients, but there's a universal, you know, universal skills that you can go there and help, even if you know.
Right. So. And so do you two think that you'll go back, maybe permanently or temporarily? Or?
She always used to say she was going to live in Ethiopia at some point, you know?
Yeah, I think that's, I mean, I'm trying to find my role. Now that I'm still in training and continuing training, I still have another at least 2 years of training to finish up. But after that, I think that's going to be the good question, because for now I've just been going back for up to maximum 2 months at a time. But I think I have to find a role that the best way can help for me. So I'm still trying to define that, whether that's through academic medicine, staying at a place like Hopkins where you have the chance to do international work versus through an international organization. But I'm trying to define the way that we can do that in the future. So.
And like my mentor, Dr. West, I mean, I'm sure she's been to Ethiopia many more times than I have, and you know, the infectious disease, Dr. Ruff. So you can either go frequently and with the fistula hospital, with the Dr. Hamlin, where she was from, where?
I think she was Australian.
Australia.
Yeah. I also got to visit that when I went back, and that was this amazing. Yeah, Dr. Hamlin and her husband had started this beautiful fistula hospital.
But they went there not thinking they were going to stay there, and they stayed there for more than 17 years or something. So I think you never know, but I certainly would like to go there for more than just I guess the longest I've been there is 6 weeks. So.
And I think when you go there, people express interest in you helping, but at the same time using the resources that you've had here. So if you just went and lived there, I feel like they would be, that, you know, they want something that sort of like I was talking about, the partnership connection, bridging here and there, using the resources here to help with the infrastructure there. So I kind of foresee that in the future.
So maybe you'll be buying a house.
She was discussing about it. She was bothering my mom about why aren't you building a house in Ethiopia? So.
Yeah, well, a lot of people their parents have a home. Yeah. But I mean, in terms of the practicality of it, I mean, it would be a major move.
Yeah.
But what, you're just playing it by
the
opportunities that come?
Yeah, exactly. I know it's going to be like a critical part of my career, but I just have to find in what practical realm that's going to play that out. Because I think by going and living there, you can contribute a lot. But at the same time, I feel like people, you know, they're rightfully pointing out that there's a lot of resources here that by, you know, traveling back and forth, by being affiliated with an institution that can provide, you know, institutional support that can help. So or an international organization or another group. So.
I mean, even telemedicine, like I was as a medical student, I remember I was in the infectious disease department, and then they were televising from Addis Ababa to hear Dr.
Yeah, I got to
participate.
It was actually Hopkins was helping, and now they have they discuss cases, infectious disease cases, with the faculty at Dr.Fasika, a lot of the infectious disease faculty, with the faculty at Hopkins, and then they present cases, have a wonderful discussion. I think it's every 2 weeks, every other Friday that they do this, so.
I didn't even know it had moved internationally, because it began here as, you know, just even, you know, doctors talking to prisoners through that means. But the fact that, you know, it's going international, and you said every 2 weeks?
Every 2 weeks from Hopkins to Woreta-Ambachew, and actually I think East Carolina University have this case discussion, and I got to see it from both sides actually. When I was in Ethiopia, nice. I got to do it, so it's very, very interesting.
So I have to ask this, the obvious. How has the twin dynamic played into your pursuits? I mean, I think a lot of people think that twins, I mean, there's sibling rivalry, but I think a lot of people think twins are just like born enemies, or I mean, has competition?
Never.
I know. Luckily, we got rid of that early because I feel like.
Oh, so there was.
Well, I feel like there was a period when before 8th grade where we were
Before
trying to
8th
define
grade,
our
you
own identities. Like you wanted to do your own thing. We wanted to define our own identities. But then when we realized we had the same interests, that we were really, one of my professors said, "You guys are actually synergistic," because we just
college.
I know our college because we actually work really well together. Like. She was my best study partner in college, in med school. A lot of times when I was like, I'm done, she would come with her, note cards and push us through. So I feel like there was really a synergy. Luckily, we got rid of the sibling rivalry thing early on, because after having that period, we really just we tried to not be roommates in college, and then we realized...
It was a disaster. By the last year, we were dying to be roommates.
Because we were always trying to meet to study together. So I think it's the dynamic emerged of one to be like a synergistic and working together. So we actually wanted to choose the same profession.
That would have been ideal.
And I tried
in terms of ophthalmology.
Yeah, we wanted the same field because that that was what we wanted. But unfortunately, ophthalmology was too focused for me. So. And I couldn't get her to do GI.
Well, I think it's best. I mean, who knows? You guys may be able to open a clinic.
My dad said she can still go into ophthalmology.
We'd probably confuse too many patients anyway.
Like I said earlier, I grew up with you, and I don't know if you know this, but growing up, I had always looked up to you two as benchmarks of what dedication can really bring about. Can you speak to this drive that you two have, and how you were able to stay so focused? Because I mean, we were talking a total of 15 years of school, 14 years. I mean, that's an exhaustive amount of time. There are marriages that don't last that long. Can you speak to that drive? I mean, I think it's incredibly noble.
Well, I think any other field it would be difficult, but in medicine you always continuously have patient interactions, so no matter how long the day, no matter how many hours you're working, your patient will say something and it'll just make it all worth it. The constant patient interaction, the constant gratitude you get from them. I think for me that is what keeps you going at the end of the day.
And I think in life you have to choose. Like I think people are passionate. Everybody's passionate about something. So I think in life you have to find what that is, and then see what you're good at. And if that works, then you just have to give all. Just put all into it. So like for medicine, I feel like if we enjoyed biology and we also liked interacting with people and this international health. It just fit with the passion. Mm-hmm. So when you have that, I feel like you have to be committed to it. You can't waver from it, because I feel like you sometimes think things are possible, it takes too many years, but I think you just have to really, once you have a dedication, you have to just put 100% into it and really pursue it, because I feel like whenever that happens, that's what defines success, because you'll be happy doing it, you're passionate about it, and it's very rewarding to you. So if you find that thing in life, I think you should just go with it and just find out what your talents are, what you're good at. If you're good at talking with people, with patients, interacting with people, or whatever you're good at, I think just really just dedicate yourself and put 100%. And that's what I feel like. That's for medicine. That was a natural path.
Absolutely.
Sorry.
Yeah, and you have a responsibility for your patients. Like for now, for instance, I'm learning how to do cataract surgery now. So I want my patients to have perfect results. I don't want them to. Because I'm learning to have any, so it's I'll spend all the time all the time I need, whether it be in the practice lab, reading, watching videos, until I can give them what when they come to you so trusting, wanting the best surgery. Then I feel like it's my responsibility to do my best to give them that.
And if you can build on this for someone who's watching back home who did well in the exam and has a real passion for medicine. What's some advice that maybe you can impart for someone who may see the process as daunting, or that they're just unsure of everything that it entails? I mean, is there some advice maybe that you could?
Yeah, I mean, undoubtedly it's a long road, like you said. I mean, the last 15 years, I mean, just exam after exam, and you always have to be reading. But at the end, I mean, I really, truly believe there's no field more rewarding. So...
Yes, and I think if that's your passion, I think trust in your ability, because a lot of times we doubt ourselves, and I think you just have to believe in yourself and your abilities, and that over time you realize there's really nothing that you can't accomplish that other people are doing with hard work and dedication. Persistence. I mean, you can become as good as anybody, and that's, no matter how daunting it seems.
Yeah, and actually, she's always been the smart twin. She's the one. It comes. The exams come naturally. She's always done better, but I always had to study more, and then even in medical school, right? Like, remember in anatomy, she was just whizzing through, and I was struggling. But don't get discouraged, and you'll.
Yeah, if that's your dream, you can with just hard work and you can achieve it.
Yeah, exactly. Finally, I caught up, I guess.
And don't listen to people if they discourage you. If this is what you really want, I think you have to go with what you really.
People were like, it's competitive, it's this, and then you just do, and if you do it from your heart with the true passion for what you do, then I don't think there won't be anything that you won't be able to achieve.
And then just listen for opportunities along the way that can help make things easier for you, and don't think that, oh, I'm not going to get this, because I remember having that thought with even this scholarship for medical school, like, oh, there's no way I'm going to get this. You would say, oh, I'm not even going to try to write these essays, but you just have to, do it, trust in yourself, write what you want, like express what your wishes are, and then people will see that you're genuine and passionate and what you're committed to, and people will recognize that, and I think that's what makes people succeed. So.
And for yourselves, what's the benchmark that you have set for yourselves? What is there a kind of like a pinnacle or a point where you say, okay, when this happens, I feel like I've kind of left my mark, or I've done what I felt, my true self has been fulfilled. Is there like a benchmark like that for either of you, both of you? The same one? I don't know.
That's a good question.
Yeah.
I'm thinking for me, I mean, I feel like the point for me is going to be when I'm finished my training. So I've gone through all this training, and I want to get to the point where I'm actually giving back, where I'm contributing. Because up until this point, you've just been focused on, exams. Now through residency, you're focusing on getting
technical
the skills.
Aspects,
exactly. Yeah. You're just, so I feel like we're getting to the point when you're done your training, when you're going to be like an attending position, or you're going to be a public health expert in something, and
I'm a good surgeon, and you can actually give back. So
to patients or into the community in general. So I feel like when you get to that point in your life where you've achieved that, that's going to be a good benchmark. Where the dream started, like when we were in high school, thinking that you're going to do all these things, but finally to get to that point when you're able to contribute to the community, to
whether in Ethiopia, East Baltimore, wherever, Miami.
And making an impact in people's lives, not just, treating just people with medications and that, but making a difference in their lives, their children's lives, by simple ways to help. So.
Well, thank you so much for being on the show, because not only serving an inspiration for myself, but I mean, this is going to help a lot of people who are struggling through maybe their exams right now, that motivating force. So thank you so much, Dr.Fasika.
Thank you for having us.
And thank you so much for watching. Don't forget to visit us at ebstv.tv. And to learn more about the show, to catch up with episodes and some fun facts, visit us at facebook.com/thebenchmark. Thank you so much for watching. This has been The Benchmark with Kallie Ejigu. Stay tuned.